We are live. It is the May 14th Urban and Economic Development Committee meeting. I'm Councilor Bellis chairing this meeting. First item on the agenda, I call this meeting to order. Second item on the agenda, discussion with Chief Medical Officer Dr. Jeffrey Goodlow regarding adoption of the 2025-2026 Medical Control Board budget.
Good morning.
Good morning.
Always a pleasure to see everyone, especially when I get a chance to talk a little bit about the health of our EMS system and then, of course, the related budget item here. We are in a good place in our overall EMS system. We have adopted the latest generation of cardiac monitors, defibrillators, airway management tools. Just last night, we administered another unit of whole blood to someone in serious trauma. So we're really, really pleased with as we continue to advance the clinical capabilities of the system. And an important part of that is the independence of medical oversight. So every year we come and visit the Tulsa City Council and the Oklahoma City Council so that we can have an independent overview and discussion toward approval of this budget. We are always very, very careful with cost conservation. We are keeping expenses outside of very small labor adjustments flat for another year. The labor costs represent a 2.5% increase for full-time personnel, and we are seeking a part-time 1099 income position for a data entry person to help us. Our cardiac arrest database is something that we put a lot of attention on in maintaining. It is just too much for one person. We have moved from 1,200 to 1,300 resuscitations a year, closer to 2,000 now. And so it's really important that we keep a tab on, how are we doing day to day, and then looking at the composite of that, because that is such a critical function of our EMS system. And so happy to answer any questions. Always a pleasure to be with you here. I will point out, I think this is, as a Tulsa citizen and taxpayer, this is a great value proposition for really both cities. 79.5% of our budget comes from IMSA CQI funding, so there really is very marginal cost that would come from any city funds. And then those would be included in the Tulsa Fire Department budget specific to City of Tulsa.
Could you clarify for the CQI funds if and then how Medicaid reimbursements factor in? I just wasn't sure how much of the budget's contingent on that.
Yeah, so that would be more specific to the CFO for IMSA, but I will say, just in general, right, a lot of attention is now being placed on Medicaid from federal administration and what that means from a state ability for taxation and their part in funding that. As a general rule, any healthcare entity, whether it's EMS, hospital-based, individual physician-based, Medicare, Medicaid, that pays something. Something is helpful as opposed to nothing. But in general, those funds are still 2 to 3% below the actual cost of providing care. So the real difference maker in any kind of healthcare entity budget today is the commercial insurance cohort. And as much as those commercial carriers are maligned, and I'm certainly not here to say pro or con about a commercial insurance carrier, but the reality is that is really the safety net of our healthcare safety net. And that is of increasing concern, because I think, to your very astute question, when you look at the percent of the public that is, at least right now, without any significant change, that would be covered by Medicare, Medicaid, TRICARE, so government payer funded, in less than 3 years, that slice of the pie, so to speak, will be 75% greater than those of commercial insurance coverage. So the challenges for all of us in healthcare, what are we going to do? They're not getting easier. And then part of our reason why we're working so hard to keep the cost of medical oversight as low as we can too. So I thank you for that question.
Yeah, of course, thank you. That was really helpful clarification. I'd heard a rumor that one of the things that's being considered on the federal/state level is quarterly disenrollment and the need for re-enrollment of Medicaid, which I know also then cuts into
And that,
participation.
and that's certainly more than a rumor in terms of that being a potential. There was quite a bit of press and health literature just yesterday about that.
Okay. Any other questions related to?
So the impact to the city of Tulsa's budget is $39,387 through the fire department?
Technically 69,000, the 39,387, and then if you look on the MIH physician position, the entirety of that is 120, but Oklahoma City is covering 90.
30.
And TFD is 30, and that specific position, and Dr. Patrick Cody is here with us today. He fills that role for us on our medical oversight team. So Dr. Cody, his duties are specifically focused on some of the innovative work that I know that you all know about, that the Tulsa Fire Department is doing, some of the downtown response, and community-wide response too, in terms of behavioral health responses, alternative destination responses, working with opioid use disorders. Dr. Cody's in a great place career-wise where he can spend a little more focused time on that, working with the medics directly involved in that, and helping set some clinical protocols. So we're really excited to support the work of the Tulsa Fire Department in that, and excited to see the growth of those programs.
Any other follow-up questions?
Thank you, Doc.
That was fun. Yeah,
Okay,
thank you. Thank you
absolutely.
so
Always
much.
a pleasure to be here. Thank you.
Thank you.
See you at Indy.
All right, agenda item 3, discussion with representatives from the Department of Resilience and Equity on the Office of Financial Empowerment and the Financial Empowerment Center, including a discussion of program outcomes and fiscal year 25-26 budget requests. So we have a few people joining us. I'll let you guys, you can all introduce yourselves as you come up.
Hi, good morning.
Thank you.
Morning.
Good morning, thank you.
Yeah. Okay, great. How many, just so I can think through our agenda, how many minutes of presentation would you say you all have to kind of upfront us with? Oh, yeah, that's great, yeah, 10 or 15, yeah, if you wanna take a good 10 or 15, and then we can do questions.
Yeah, okay.
Yeah.
So I'll get us started. So Deputy Mayor Crystal Ray is here, and I'm here with Amber Gittens, our Director of the Office of Financial Empowerment, and DeAndre Hayes, our Director of the Office, or the Department now, Future of Resilience and Equity. So I wanted to kind of give a little bit of the institutional history around FEC and OFE, and then pass it to Amber to go through the outcomes and a bit about the budget and budget requests and kind of funding situation that we have now. So hopefully that's a good layout. And we also have our managers from the 2 FEC programs here as well that have joined us from Tulsa Responds and Goodwill. Just a little bit of a reminder on the history. We launched the Financial Empowerment Center, which is a free service of the City of Tulsa to offer free financial counseling to any Tulsan. Really, the requirement's to be over 18 and either live, work, play, stay in the City of Tulsa. We launched that in 2020 after a year-long effort with over 60 partners to develop an implementation proposal and receive a grant to seed the program from the Cities for Financial Empowerment Fund, which is a national organization that works with financial empowerment centers across the city. And so in 2020, we launched with Goodwill as our partner. And for the past 4 to 5 years, we've really grown that program to serve more Tulsans and to, importantly, integrate with other programs. So over the past years, and of course this includes our experience through the pandemic, we integrated financial counseling with our eviction rental assistance with Restore Hope. We had a grant to integrate with workforce programs, so we did that with Madison Strategies. There were some homeownership programs that were established during the past few years with MetCares and other organizations. So we were a referral partner to help people get on a path to maybe a higher credit score so they can be eligible for those mortgages. And then, of course, one of the integrations that we're really proud of and has great outcomes is with municipal courts. And that's gotten great outcomes, but also it has become a model for other cities, and we've shared that nationally with our partners on how we've been able to do that and help support people get out of debt and also get on a payment plan. And so that kind of all happened over the last 4 years. In 2023, we issued an RFP as our contract with Goodwill was coming up, and we actually had Goodwill and Tulsa Responds respond to the RFP, and so we're able to expand our services even more, which is wonderful. Those contracts have, been in place. And so right now we have our 2 providers, and I'm going to stop there because Amber will go over kind of the reach, the outcomes, and the impact, and then we can talk a little bit more about the budget.
Well, hi, everyone. That front sheet document that you have really is really what we would like to share about some of the great outcomes that the Financial Empowerment Center has had over its lifetime. The biggest one being that we've been able to help all of our clients reduce their non-mortgage debt by $2.06 million. We've seen them save over $664,000, and that's with participants having an average of 2.5 sessions. We've been able to see over 464 clients reduce their debt, and that's giving an average of $4,454 per person. We have over 523 people that reduced their delinquent accounts. 425 have increased their credit scores by at least 31 points. We've had people average their savings. The average savings for the program is about $3,178 per person. And we just, you can just kind of see that the numbers continue to increase. We've had over 978 people receive their credit report and score, and that really is the beginning of this program. So, really for context, when people come in to the Financial Empowerment Center, they're coming in because they're at a space where they need assistance. They're not clear on the financial literacy or the impact or what they need, the structure they need to move forward in their finances. And so what they do is they come in and they're able to receive a credit report. We're able to pull it with no impact to their credit. A soft pull, we create a budget for them, and then really work on a strategic plan that works on their financial goals. And that's where we begin to see these major outcomes. Our demographics really kind of lean into about 70% women, 25% men, and about 5% transgender or non-binary. Our average client age is right there, kind of in that sweet spot between 30 and 40-year-olds, people that are wise enough to know they need help and to ask for it, right? The average income is about $28,000 per person, so we're helping our most vulnerable residents in our city. And you can see that 70% of the clients really have engaged in 2 or more sessions. And so the majority of our clients have 1 or more children, so our impact really is focused on families and our most vulnerable residents, and that's the major impact you're able to see within our program. On that second,
Can I ask you a question?
oh, please.
So how many years of data is this? So $2.06 million over a year, 4 years?
4 years.
Okay.
Yep.
And do you know what it cost over those 4 years? Like what is our cost to save $2.06 million?
Yeah, so the program costs, we have 2 FEC providers.
Sounds serious.
I know, I just didn't know if I
Don't
should
even
keep
know
talking
that.
or
May I
not.
have your,
No, it doesn't
Okay.
sound
We're
serious anymore.
You just keep going.
Okay. I was like,
That was his slide.
Is it an emergency or not?
Like not a chemical event. Okay. That was my
Yeah.
anxious assumption.
There we go.
Okay. All right, carry on.
Yeah.
Obviously, it's not the first one that's. No, it's on the.
So,
Sorry.
no, you're okay. The program costs about $300,000 per FEC. So we have 2 providers, so that's about $600,000 annually.
Okay, so did it cost us $2.4 million?
over
4 years?
4 years, correct.
Okay.
But when you say us, we're not talking about the city of Tulsa. This program has not been
Yeah.
publicly funded.
But city,
I
you
should-
mean city ARP, but what about city ARPA dollars, or no, this is like,
There,
you're saying
there
private?
have been some,
Okay.
yes. The majority of the program has been funded privately, which actually leads me into our third
Yeah.
Okay,
slide.
we can.
Sorry, and I should.
Yeah.
No, and one thing,
Scared to ask, if I could even ask.
one piece of context that I think I'll like add though, because I like, you know, I kind of, I definitely shared Councilor Lathan's question, or if we talk through the budget, or as we talk about this, or looking at this data, yes, it includes several years. I know some of that though, maybe like ramp up years, you have the pandemic in there, so I do want to acknowledge that,
Yes,
or that
ma'am.
could change direct services. So it's a little hard to, you know, it's a little hard to tell, or I know it's not saying apples to apples for every year that the program cost X amount and got this, because it probably really, I can imagine it varied. Well, also though holistically, that is a number that's hard to.
Correct. The other thing, I'm so glad you brought that up. The other thing is that our second provider, Tulsa Responds, actually did not become a provider until 8 months ago. So we're not talking about $6,000 or $600,000 over the course of 4 years. We're talking about $300,000 for the first 3 years, and then now with Tulsa Responds being a partner organization, that cost being allocated in the last 8 months. So, does that make sense? So if it's $300,000 per FEC, we didn't get a second FEC until 8 months ago.
Okay, so it's really not cost 2.4 million bucks.
No.
It's more like 1.5 million bucks. And maybe even a little bit less than that.
Correct. I would say a little less.
Yeah, you can send a better number.
Yeah.
I-
I think
you don't have to
the
do
best
math
of your
on the
ability,
fly.
we'll keep presenting through whatever this is.
Okay.
It's always hard.
May I have your attention?
This is a test.
Of what?
That, well, of the system that we're trying.
Of the emergency broadcast system.
Okay,
Yeah,
yeah.
I'm glad they've chosen this timing as well as the people
It's
upstairs who
great.
decide to also do construction.
Oh,
As the person facilitating this meeting who has ADHD, it's going pretty. Okay.
wow.
All right. But yeah, everyone do
Well,
their best.
we
We'll
need
just
a
plow
final
through.
What I would add is, on that second sheet you have, it's really, we wanted to share the most updated numbers for the impact that you can see by district. And so, as you can see, District 1 has a large portion of FEC clients, as well as Districts 3, 4, 5, and 2. Those are our largest impact districts, but every single district has participants from the FEC or to the FEC that are receiving these services and seeing these outcomes and contributing to the outcomes that you can see on that first document. And then lastly, is a quick, really kind of quick budget overview. I think one of the counselors kind of had some questions regarding it, but we wanted to give just a clear overview of what the budget looks like. And what I'll actually do is I will pass that to you, if you'd like to go over the budget. I'm sorry, our CRO, DeAndre Hayes.
Okay, great.
Yep.
So the document that you have before you just gives an overview of where we started. So with Goodwill being the first partner for the FEC, this year, we'll say the fall of 2024, they began with a little over $230,000 in their coffers at an average of up to $26,000 is what costs can be incurred for this program. So we anticipate that we've got enough fund balance to cover this contract through the beginning of July, that being July 1. And that includes private funding that we acquired, coupled with the ARPA dollars, as Councilor Bellis asked earlier, to this program, and that's how far it carries it. I want to mention, too, the importance of the partnership at the bottom, because I understand there were some questions about municipal court. We consider that a priority partnership, and that is one of our counselors being on staff at their site 3 days a week from about 9 to 12 p.m. to service the clients who are coming in to help reduce the fines. So it's a joint partnership that is covered through our fund dollars. So the additional $150 that we're requesting would allow us to carry this fund for 6 additional months while we are still in the process of grant funding. One thing that's unique, I think, about Tulsa's FEC when we compare it to other programs is that our city is now being asked to partner with us in funding the work, whereas in other places, some cities take on the entire cost. But our counselors have been so gracious, even last year in our funding, to consider the Office of Financial Empowerment. So we just want to continue to build on that work and to be able to carry it forward with 2 providers. The second you can see is Tulsa Response. Now, that's a different category, and those are our partners that came on 8 months ago, and they're seated behind me, so I want to acknowledge them and the phenomenal work that they're doing. And that contract began with ARPA funding to the tune of $300,000. They also are in a very unique situation that they have additional grant funding of $300,000 that they can leverage. So that carries them through the end of December 26. So we have the ability right now to continue the partnership with Tulsa Responds, and the additional funding that we're asking from you all will help us to ensure we're able to continue the same level of service through Goodwill for an additional 6 months. I do want to point out that we are seeking additional partnerships and that we've applied for several grants. We've had a longstanding partner who has funded us for 3 years that we are reporting to, and we are expecting to make an additional ask of them as well. So I don't want the counselors to think that we are solely dependent on city financing for this initiative, because it impacts so many families. It helps to prevent homelessness. It's having great impact, as we discussed early in the numbers. We think it's worth funding, and so we are doing our due diligence to seek matching funds, as we've done since the inception of the program.
Wow. I know.
I know, sorry.
It feels personal.
I will
May I have your
vouch
attention,
that
please?
Sarah has asked them
The
to
emergency
fix
condition
it.
in the building has expired. It is safe to return to your work area.
Good thing we all followed whatever the directions were.
Good job,
So
everybody.
much for returning.
As a quick clarifying question for the budgetary ask, and I know like I
May I
have a
have
few other
your
questions, I know other
attention,
counselors do as well, but just
The
to clarify.
emergency condition
So it's
in the
almost like you're
building has
asking for
expired.
$150,000.
It is safe to return to your
I'll let her
work area.
finish. So you're asking for is kind of like $150,000 of like gap funding while you pursue other funds? I just wasn't sure what it looks like on, and this might be a question for, I see finance over there, but like, so that's
May I
on,
have
for
your
the upcoming
attention,
fiscal
please?
year.
The emergency
Is that
condition
on
in
like
the
the same
building
amount on
has
the plan year
expired.
two? I was just thinking
It is
through
safe
it when
to
you're
return
looking
to
at
your work
multi-year.
area.
And Crystal probably can speak to this
Okay.
clearer too, but to my knowledge, we're asking for $150,000 in this fiscal year end, as well as the next, which is just a portion of the overall cost of the
Right,
FEC.
right, okay.
So I think the idea here is to have a model where we can show our funders that our city is invested in this
Which
program
I understand
as
really
well.
helps leverage
It
private
does,
dollars.
it
yeah.
really does.
Okay. That's helpful. I just wasn't sure
Yeah,
if
that's
it was like
complete- the gap.
short-term gap.
Yeah,
Okay.
So like a supplemental to get to June 30 is the 150.
to get us to the end of the year, and we're hoping to.
Calendar year?
Calendar
Calendar
year,
year.
yes.
For
Okay.
the rest of the, yeah,
Okay.
for the full year. Yep.
Okay. Yeah, Counselor Dectory, I know you had other,
I do.
or did you have more you wanted to?
No, that sums up the budget
Okay.
overview. We're open to any questions that you have.
Yeah, I have a few, but I'll let you.
I have some questions, thank you. So we learned last week about the municipal court contract, and that is separate from the other things, correct? So this 86009.
So we want to clarify that, and I know you can give some context
Yeah.
regarding the historical data of the municipal courts and the unique fund that was used to start that. We've had some conversations with Sherry from that department to make sure that our departments are in alignment, especially how we answer your questions. So we consider that a priority partnership that we are able to fund through the Goodwill funding. However, this is the caveat. Because they were started with a separate funding source than what we have, when this contract expires, as it's set to do in July 1, if we don't get additional funding, we would not be able to support the municipal fund. They currently have ARPA dollars, as you can see, Councilor Becker, I don't know if you have this in front of you, that would carry them through a little longer, allowing for one counselor to be on site 3 days a week from 9 to 12 p.m. But without the Goodwill program in place, there would be no continuation of the municipal partnership once those funds expire. So that's what I think the clarifying point needs to be made. And so we're not asking for two allotments, one for municipal courts and one for FEC. We're asking for support of FEC so we can continue to prioritize that partnership.
And that support is the 230 plus 86.
So the 230 plus the 86, no, so the 230 is what the fund started with. Our ask of council is $150,000, half of what it costs to run the program. So each partner is $300,000 contract to ensure that they're able to fund their operations, salary, and some admin to keep the program
So
running.
150 in the fiscal year, Deputy Mayor, or is it 300? Because
150 in this fiscal year 26. Yep. And
that'll go all the way to June 30th, 2026.
we're hoping to leverage at 150 to be able to raise the other 150. Yep.
150.
Mhm.
Okay. That clarifies that. On these statistics, thank you for the one sheet. The 5894, is that duplicated or unduplicated? The clients. So I guess to rephrase.
No, that's not duplicated.
Those are individuals, no
Right.
matter how many times they
Yes.
came.
Right.
Okay, thank you. And then how many unduplicated do you have per fiscal year?
So on average per fiscal year, we serve about 1,000.
1,000?
And we do about 1,900 sessions.
So that's kind of, this goes back to, so just so you know, a question I had asked earlier had to do with knowing that they've had ramp up time and also like with the pandemic. And then they clarified that they brought on Tulsa Response about 8 months ago, so I know that that's a multiplier, so I'm guessing it's kind of like scaled to a certain amount each year.
Right.
Do you guys assess though within that, sorry, just a quick follow-up related to that number, like for each of these partners, if they're all, you know, they get the same amount to do somewhat of the same thing, though I understand Goodwill has the municipal court element, but what, like, is it like you guys do quality improvement work with them if one partner for the same amount is serving more clients than another, or how does that?
Like, is there a ratio?
Yeah, like, because I could imagine, you know, you give like, say you give two different contractors each 300,000 to do this, and one's serving X number of people a year, and one's serving significantly less. Do you guys
Yeah, I
evaluate?
guess,
So like
or
a
I can
per
speak to
capita?
how we've done it,
Yeah.
over the past few years. Yes, there's a requirement in the contracts of how many sessions per counselor, how many counselors to have, how many sessions per year. And so there is a ramp-up year for new providers. So in the first year, that requirement is less. And we have worked with our FEC providers when, you know, they haven't had as many counseling sessions. So we worked on creating metrics and outcomes and checking in on that, and that's worked well in the past.
Good. And just the final question I have, so we know that other cities are doing this work, we just heard that other cities are funding it at a higher percentage than we do. Are the outcomes of these peer cities with, you know, similar programs, how are our outcomes compared to those, especially as it pertains to like size of city and demographics? Like, are we
Yeah.
achieving at the level, below the level, or exceeding?
We are generally achieving, so about, was it 30% of clients in all FECs are achieving these major kind of those outcomes, credit, debt, savings, banking. And then, of course, there are interim milestones that happen before that, many, many more. So we are on par, and we're actually kind of supporting other cities as well, and how they're doing FEC.
That's what I was going to add, is that we recently were invited to the CFE, Cities for Financial Empowerment Coalition, and even there, based off our outcomes, we were asked to be a speaker and share about some of the work that we're doing because of the great outcomes that we have.
Great, those are mine.
Counselor Bellin?
Yeah, so this 5894 number, is that for the 4 years okay? And then the total active clients is 1849. So the other 45, what is the outcome? Are those currently in the system?
It means that they're no longer being serviced, so either they are done receiving their services and have achieved what they wanted to achieve, or maybe they moved, or they're just not actively receiving services anymore.
Okay, and that all equates into the numbers that you've come up with that 40-45.
Yes, ma'am.
Okay, and then I'm looking at the 71% female clients, which is really astronomical. Is there a transportation issue associated with accessing the help that they need?
So the great thing is Yes, right?
Okay.
So the great thing is that we provide virtual services.
Okay.
And so people can do it by phone, they can do it online, and then they also can come in store or inside to one of our locations to receive services. But transportation can be a barrier in some areas and in some neighborhoods. But that is why we do our best to provide multiple options for those participating.
Okay. And then I was looking at the open to save and affordable bank account. 180 seems like a low number.
Or is that other people already had an account with it?
There-
Is that what it is?
Yes,
Okay.
so the people so this is contributing to our Bank On program. Our
Okay.
Bank On provides low cost, no cost, or second chance bank accounts to anyone that would need it, and we're partnering with 14 different banks across Tulsa. With those banks and bank accounts, they're typically for people who have not had a great banking relationship, who have overdraft, wrote a check, did something where they just did not have a great relationship moving forward and needed a second chance. That is not all of our participants. That's going to be some of our participants that needed a second chance bank account. And so we've been able to assist 180 of them so far.
Okay. It's really interesting, the numbers. I'm really glad that you presented this. The non-essential, I'm just wondering also what that usually entails.
Yeah, you know what, I will actually ask Hugh, can you share what so Hugh is our program manager over at Tulsa Responds.
Oh, good.
Oh, you have to.
I did this where y'all put me on spotlight.
I'm so
The
sorry,
best part is
Hugh.
that you actually can sit here so the mic can
Yes.
touch you.
Oh, I'm sorry.
Could you
Okay.
share what
Yeah.
typically not essential
Yeah, you
Okay.
can come over.
expenses are, or what you see
Oh.
or experience as a counselor as well as a manager for non-essential expenses?
Yeah.
So
Thanks
good
for letting us
afternoon,
know this.
everybody. My name is Hugh Lay. I think I know some of y'all.
Yes,
So,
hello.
the non-essential expenses, I think, to answer your question, is that let's just say phone bills, right? We find that a lot of our clients overspend on their phone bills of like $50, $60, $70 per month. And what we do is where we said, hey, listen, we have a $25 phone bill, a $20 phone bill that we can refer you, advise you to go get this. And guess what? That $70 cut down by 25, you save $45. And what you're gonna do? Put that into a savings account. And that's how we are able to get those savings number increase for each of the clients. Another non-essential item could be, whatchamacallit, a lot of our families, they come from low income, vulnerable communities, right? They don't know that they can qualify for Cox, $10, low income internet, right? And they said, I'm paying $150. I said, hold on, wait up. Wait up. We can enroll you into a $10. Let's go ahead and have you do this. In addition that, we then refer people over to our in-house services that they can get other services complimentary to them coming to see the FEC. So I hope that answers the questions.
That
in
did,
regards
and
to-
then if you're available to look through my family's bills later.
Oh, listen, let me tell you something. This is what I tell.
Do you
Oh,
have
yeah, go
three
ahead.
Netflix accounts you don't know about?
I don't want to talk about it. Thank you, that was a really helpful
Yeah,
clarifier.
thank you.
Thank
I
you so
appreciate
much.
that.
If I may.
Oh, yeah.
Sorry.
Yeah.
Marcella Swenson, Executive Director of Tulsa Response.
Come on over
Oh,
here.
okay.
Yeah, now you guys just get to sit
Don't
here.
be talking
It's
over my
fine.
shoulder.
Yeah, you're good.
You're on our agenda.
Hi, sorry. Marcella Swenson, Executive Director of Tulsa Response. And I just wanted to say, so Hugh mentioned, saving $45 on a phone bill. That's 1 month, so one intervention over time. That you calculate what that is a year, what that's going to save a family a year, and that goes into perpetuity. So I just really want to highlight what that one session can do. And also, Hugh, you had mentioned some of the other complementary services. And so part of our model and why we were so interested in doing FEC was that we offer SNAP enrollment, Medicaid enrollment, free tax filing. And so this gives us an opportunity to refer those clients to the other services. So we're just trying to find all the different ways that we can stabilize a household.
Thank you so much. I think y'all can just stay if you're if you feel comfortable by now. Again, there's like 3 people online, don't worry. All right, Counselor Gilbert.
Yeah, number one, I appreciate everything that you guys are doing. This is phenomenal work. But is there any way that we can get a more detailed budget from you all, just to show revenues and expenses for the past couple of years, and for the current year and forecast for the next 2 years, just so that we know where FEC has been, is, and where it's going from a financial standpoint.
Yeah, and I'll tag on to that with, it sounds like, Ray, there's a lot of those external private dollars, but we can't see that in the
Right,
city
right.
side of the budget, and so that would be really helpful to see
Yes.
what scale of things are being leveraged,
Yeah.
because we just don't have that detail.
Yeah, Counselor, and we've been really creative over the last few years of public, private, and stretching out
Oh,
dollars.
that's great.
So we're gonna,
Yeah.
we'll do kind of, I think 2 years back would probably be helpful.
Yes.
And then, we can also kind of share, where we're trying to seek funding and what grants we've applied
Okay,
for too.
perfect.
The idea
And
is
what's
that-
the long
Yeah.
range,
Yeah.
forecast for it? Because, I mean, we definitely, you guys are doing such a great job. I mean, we need to keep this going, but from a financial standpoint, we just need to, I would like to see more detail of it.
Yeah, we can get you that.
Councilor Dr. Wright?
Last week or the week before, I've slept since then, we had that presentation on Save Our Homes. And Save Our Homes initiative, I know that's kind of like gonna sunset if something doesn't happen. Is this something that you all are also working on? And
Yeah, they were part of
extending
the-
it, yes,
Yeah.
but like in terms of not sunsetting it, because I'm hearing like what I just heard here, and I'm also thinking, we've had that conversation of paying out over time, or paying yourself over time so that you can make the balloon payment, and is that part of this?
So right now, it's a referral, so we actually do track how many SoHi participants have gone to the FEC. It wasn't kind of a requirement.
Just an encouragement.
A referral, but absolutely, I mean, that was why we were kind of part of creating that program or helping Counselor and Rose develop it, because to be able to not get into the situation where you're behind and can't have that buffer to make the payment. So that was the plan, to be able to support people to save and also make those payments going forward.
So is there an ongoing conversation of how to keep SoHi going as part of the FEC, or no?
Sounds like you started one.
Yeah.
Well, I'm just hearing like impacts that he's talking about, take that 45 and put it in savings. It could be like, take 25 of that and put it in your property tax, because we know that in District 1 and 3 and 6 and 2, people are losing their housing, generational housing,
Yeah.
because of these structural barriers of just not being able to do incremental payments, and until we get a treasurer to agree that maybe that would be a way to serve the community.
Yeah,
we've
that's a
gotta-
structural, yeah.
We've gotta figure
level.
out, because it's gonna sunset, we've seen proof of concept,
Yeah.
and I just don't wanna have the unintended consequences of like that program went away, and so that problem's still there.
I think that's definitely a great conversation that we can dive deeper into with the SoHi team, and Rose, who's great at
Sure.
TEDC. But you brought up a great issue that the Cities for Financial Empowerment Center and the FEC is actually planning on tackling. And so the next program that we are rolling out is actually legacy planning. And part of that is really providing a clear trust for them and for no cost. So as long as you are a client of the FEC, we'll help you and give you a program so you can build out your trust, so you can allocate where your home goes when you pass. What happens to your children when you pass? What about your bank accounts? A lot of people feel like, well, it's only if I have a home, but if you pass tomorrow and have underage children, where do they go? What do you have that legally assigns your children and transfers, right? Even small things like your bank account. And so that is really our next step that we should be rolling out this fall with the FEC, which is why it's even more important to get these funds so we can continue to move forward in those endeavors.
And then out of curiosity, so that's, like, you all are contracted with the FEC, and then they're providing, like, I just wanna make sure I understand structure, like, training and resources that then, like, a contractor here, like Tulsa Responds, accesses to then implement those programs.
All the counselors got trained,
Okay.
there's a whole legacy planning training, and then also, it's part of a broader initiative, I think through the CFE fund. So we're hoping that, we can leverage some of those relationships too, to support something like SoHi, cause, there's a counseling piece, but then there's actual, like, the cash to pay the
right.
arrears.
Counselor Dutton?
Yeah, so I was also wondering how the cuts stopgap is going to affect the vouchers for those that don't own homes, that are receiving HUD vouchers. There was that article last week indicating it will affect 2,000.
Which I'm sure overlapping clients.
Yeah, and so I'm just wondering if there's contingencies in the budget plan going forward for those individuals that may see evictions and facing homelessness? What sort of
Like
contingencies?
proactive
Mhm.
planning.
Well, what I can say is that almost a quarter of the clients that we already see are experiencing some level of homelessness. So that's not, unfortunately, not new to our counselors at the FEC. And I think Tulsa Response, both Tulsa Response and Goodwill are doing an amazing job at empowering their teams and adding additional, whether it's admins or counselors to their teams, so that they can be prepared for all the things that are going on federally and nationally
All the
regarding.
impacts are right on your clients.
Yeah.
And do you have bilingual services?
We do.
We do.
Trilingual,
Yes.
multilingual?
Well, listen, that part, I can't, not yet.
We
And
offer
I'm-
Spanish and Goodwill has more languages.
Yeah.
Dari, Hmong.
Good, good, good.
Sorry, it seemed like you were about to clarify something else, Hugh.
I wanna highlight some of our partnerships right now, is we do have a very good partnership with the Tulsa Housing Authority.
Okay.
Under their Family Self-Sufficient Program, where they are enrolling this, I don't know if you all know of the Family Self-Sufficient Program, but we actually have this partnership where they are able to refer their clients over if those who are interested in, getting a home after graduating from the program, right? So they said, hey, they need to get their credit up, or they need to get their savings, and these are some of the requirements that we help Tulsa Housing Authority fulfill. And also too is that, I think I told myself and Amber this, is that we are actively seeking and collaborating with new community partner organizations in order for us to really support Tolson. Because our main goal is, at the end of the day, to support Tolson, right? We start from a bank account going all the way to legacy planning. That is a long step. And I want to clarify some things regarding the Tulsa residents served versus the active, is that sometimes clients just come for one session because that's all they need, right? Or they believe that's all they need. But the active clients are those that I have personally having active clients that have gone through 7 sessions. We started from 0 credit to 600 credit. That is a big jump, right? This person has saved over $1,100, $0 to 600. So this is a great impact that we're doing, not only through CFE, but also City of Tulsa, and also us, as a provider. So thank you.
Hugh, thank you
Love
so
your
much.
energy.
And I wanted to underline Hugh's point around the sessions too, that it is such an individualized model, that it's not like one client, 5 sessions, that's like what we call. So I think it's important to know that the sessions are one of the key metrics of how, the sessions are what get us to the outcomes.
I have a program curiosity. So, the municipal court program, like those counselors are on site in the court building providing that service, which we've heard from the courts how high impact, right, that on site element can be. And then, I'm seeing, okay, because I think something that it's been kind of easy to think of when I look at the number of clients served over X number of years, again, acknowledging pandemic, ramp up years, new partners. I'm like, that's not that many Tulsans. It's easy, I'm just naming,
Yeah.
it's easy to see that and say that. And when you break out the, like, all-in cost it took to serve that many people, like, putting a nonprofit hat on, I'm just naming my, like, my funders, if I, like, as a nonprofit person, would be like, have questions, right? I'm naming all of that. But I also know that there's like ramp up years and there's a lot like of scaling happening there, and as we all just said, there's a lot of external dollars to also really look at. I'm curious though, so there's that on-site element where we know how, especially with transportation barriers and so much else, like someone's right there and how high impact that is. These are like people served. Do you all have referral numbers where, because I'm sure a lot of people benefit from these programs and get referred to the partner agencies, and then it's always that gap of who actually makes it, shows up, like all of those challenges. I'm just kind of curious if there's like, because part of it's like,
referred.
yeah, like if there's that, because I bet there's like a larger, there's,
handoff.
yeah, I'm just curious because I'm sure there's a large referral pathway, and then it's a matter of how you actually get them to have that really potentially high impact one meeting that makes a difference, or what those numbers look like.
And where they're coming from too, yep.
You mean referrals into FEC or referrals from an FEC appointment to other resources?
I would say both.
Both, yeah. I think that just that, I think it might be helpful to like, because I think part of it to me is like, obviously the program's high impact, it's just if someone actually accesses it, part of that's like referral networks, and part of that's they actually make it to the appointment in whatever format it makes it in, which it sounds like is actively being scaled up. Hence, like, I'm not saying, oh, these are low service numbers, they're like high impact ones. But it's just that when you look at the all-in and this many people, and we know how many Tulsans are in poverty or benefit from this, it's okay, how do we make sure the most people are getting there, which I know is something you all are working on all the time. But I was just thinking through that, what we heard from the municipal court was how high impact it was that was on-site, co-located with them. And then I could imagine, and I know all these partner agencies are in the community trying to be where they need to be for people. So that's just made me curious of, this is who got these appointments, but I'm sure there are a lot of other people who've been like sent your all's way.
Also, accessing the services is not income-based, correct?
No.
So when I think about legacy planning, I mean, I'm thinking maybe I need to make an appointment.
I know that's all the
About
me
five of
give you
those
my card right
questions,
here.
about 5 of those questions you asked, I thought, oh, that's on our to-do list, you know?
Yeah.
So I think, obviously, the most vulnerable, we want to make sure can plan the way that you're talking about with those resources that, when you're in survival mode, you don't even think, should I call Cox and see if I qualify for a program? You know, between the 3 jobs you have and running people around. So, but I also think some of what I heard, and I look at the distribution across the districts, immediately my brain was like, let's overlay the low mod map that we have and see. That's just something on the council side, as we're looking at these other indicators for where we need to invest time and resources, because I think there's probably a lot of parallels there, right? But to see 106 in my own district tells me I need to do a better job as a counselor in my town halls and my HOA meetings, boosting the signal on this, and talking about things like, hey, you just bought your first house, you have 2 kids, have you made those plans? Because I bet a lot of them are like, I don't have an attorney, or I don't have the $5,000 to do the estate planning. And elders as well, right? So many of us are taking care of elders and children, and so the crisis is not the time to make the plan. The crisis is too late. And so I would love to boost the signal, because I do think, to Counselor Bellis's point, when you see 6,000 out of 410,000 Tulsans, it's like, what's, you know, as we're like kibitzing over every dollar and where it needs to go in the city, especially if
Sorry.
my grandmother.
Thank you.
As we're negotiating where every dollar needs to go in the city, if we could try to see more people coming through the doors, even if it is the one time or the 2 time, that cascade of benefits that then comes, because to your point now, the children are protected. Maybe the parents share about how they protected them, and then that seed is planted for future planning down the way, because, you know, there's young people every day coming, you know, of age
Well, I'm
and
glad
need the literacy.
mention this. I'm curious. I've been thinking a lot about with the sunsetting of, or cutting really, of like LIHEAP and LEWOP, right? Those like bill assistant programs when it comes to people, knowing that right now we're looking at likely water and sewer bill increases, PSO and O&G increasing costs. I'm also curious if, you know, because people call into 311 customer care to talk their water bill a lot. Is this something that customer care is trained to refer to? You know, because people call and they're maybe trying, if they know to, they try to set up a payment plan, or their water's about to be shut off. Is there a pathway there for people to enter?
Is that a referral, like a 311 referral?
I have to double check,
Loop.
we included a knowledge sheet on the FEC with the 3-in-1 team, and we've trained, presented to customer care
Sure.
team members in the past, but we should probably refresh that for sure.
And United Way
I was gonna say,
also
we
is one
are
of those
the two-
partnerships,
the two
a
on one,
referring
yeah.
partner.
Maybe, who's our cash payment, is Restore Hope? Like, it would just be good
Yeah.
as people move through these systems, right? Because if you're struggling to pay your utility bills, we know that's a strong indicator for possible housing insecurity, food insecurity, those kinds of things. So I guess I'm just gonna take ownership. I've known about FEC, you know, Crystal's come many times to share about it, Janae Bradford before that. And so I think I need to do, when I see that 106 clients are coming from my community, knowing that I have the most apartments in Tulsa, I need to do a better job of amplifying like the resource. And I do, on one-offs, when people call and say I'm struggling to do the thing, I do refer, but I think in a more broad sense of at town halls and at a lot of neighborhood meetings and things like that. And maybe even, I don't know what signal we boost through the public school system, but you know, is Union Public?
Actually, Tulsa
Tulsa Public.
Response has a location, a site location at the PRC, the Parent Resource Center, so.
And TBS?
Yes.
What about Union, though?
Just not at Union.
So most
but
of Union Public
definitely
is in my district or adjacent.
We'd love to have a conversation
Yeah,
though
we
and
should
get that
definitely
going.
be doing that.
And then-
Absolutely.
And Jinx.
As a clarifying question for the numbers, then I have Counselor Dunn, and I know we're probably gonna, no, we're okay. For another like 2 minutes, but I just wanted to check, do we have a sense of, right, it's like, here's the, you know how many active clients you have, or what's been served a year? Do we have a sense of, hey, with this funding, this is the full capacity of how many people we think we could be serving? Cause like, right, like, I'm gonna guess, like, it's not at capacity currently, partners are scaling up, I'm curious if you all are going, okay, when we have, like, I see you have 3 FEC counselors for Tulsa Responds, what's the capacity where you're like, we could actually, through these 3 people at full capacity, serve this many people a year? Or do you all have an idea about that, or I wasn't sure if you
Yeah,
guys
there's a
estimate
target.
that?
I don't have that off the top of my head, there's a target there.
We can follow up with that.
Yeah, you don't have
information.
to, don't feel like you have to do the world.
So we are taking notes of the questions you
Okay,
have, and we
sure.
will continue to, give you
'Cause I
more
think that
information
would
as
be-
the questions come in. A follow-up
Yeah.
document would be
Yeah.
helpful for you.
Yeah, I think that'd be super helpful just to go, hey, like, you know, with like this, you know, cause there's like, they've started up pretty recently with continued funding at full capacity. We believe we could be doing X number of people a year, I think is really helpful information to help kind of break into some of the year over years, like numbers that are part of just, hey, there's been ramp up years.
Would it be possible to add to this dashboard too, like the top 5 or 10 reasons they come through the door? We see that with the housing, point in time count, like what has caused people to need services, and the 71% female is quite
Yeah.
compelling, and the 28,938 is their average income. Those are other policy indicators that we need to be working on or advocating for.
Counselor Dunn?
So the numbers that are reflected for the council districts, that's just for this year, is that correct?
That's, those
As
are
of
active clients, so this is from
May
active
9th.
clients, and actually, this is actually only 1,769 if you add the numbers up, because those are the only, either the clients lived outside of the districts,
Okay.
so we could not include them, or they did not have a latitude, longitude on their address, so there's just a few that
Okay.
don't have that yet, maybe they're in like a new build or something, in VA or a new apartment or something, but,
Sure.
so this is 1769 out of
I was
that
also
1850.
Wondering about the generational wealth in housing and property taxes, and seniors wanting to pass on that generational wealth. How are you perceiving the property taxes and the payments, sometimes not, the ability not being able to maintain the property taxes at the end of the year? That's a lot for somebody on a fixed income to suddenly be slammed with property taxes.
Yeah, I think that's how we became a referral partner for the
Okay.
So High, the
Oh, I didn't know
Saving Our
that.
Homes
That's so
initiative, is
Yeah.
really the effect that we were seeing, and then the effect that they wanted, how they wanted to affect those clients and those
So it's kind of like
residents.
the one-time help to get on path, but then you gotta stay on the path.
Right, and a
Yes.
part of them staying on the path was being referred to our
Yes.
program, so that we can give them
Yes.
enough budget to put money aside for subsequent years.
And I think Counselor Hall Harbor talks a lot about,
Yeah.
like, a lot of these folks didn't purchase a house, so it's not rolled into a mortgage the way a lot of us come by taking care of those things. So they've inherited a thing, which is a great thing to have, but then it's like, if you didn't go through the purchase process, you might not even know that you have this obligation.
Exactly.
And if you do know, you get to it and you go, how do I come up with the $2,500 all at one time? So that's what So High's been doing, but it's going to sunset in June, I think I saw, so. I'm glad to
Yeah.
hear that there's already some contemplation of like, how do we bridge over, yeah.
Yeah, I'd like to be able to see payments being able to be made through the treasurer and.
That's a whole other story.
Yeah, I know, I mean, it is, but we're gonna work on that too.
Yeah.
But, are you also,
He's coming?
oh,
Oh, so
good.
you'll get to make the request directly?
Yes, and I will.
Being
And,
able to do
is life,
installments.
senior life services also partnering by chance?
They're a referral partner, right?
Yeah, referral partner.
I love it.
Any other? Oh, yeah.
I wanted to touch on two things. I'm sorry, I didn't catch your name.
I'm Counselor Decker, right?
Oh, thank you. So you had mentioned Restore Hope and the rental assistance, and I wanted to call out that we take referrals from them. They're a referral partner. We've been able to make 10% of referrals that have come through to us. We've been able to make appointments for them. That's a big gap. And one of the things that we could use everyone's help on is closing that gap, because when you're in crisis, when you don't know where you're going to be living in a month, coming to Hugh and learning about how can I save $45 on my internet or on my phone bill, it's not the high priority, but if we can reframe the messaging of there is rental assistance, it's gonna take time and it's limited, but what you can do right now at the same time, while you're waiting for that pledge to come through, we can help you save on these other things that you can, instead of spending your money on food, we can enroll you in SNAP. Instead of the money that you're spending on your phone bill, this is money that you can put towards your rent. So the more that you can help share that message when you meet with your constituents, the better that will encourage them to come to these meetings and see the immediate impact of them. And then the other thing I want to say about FEC counseling is it's one of the few programs that we do that is actually the ounce of prevention versus the pound of cure.
Sure.
And it is hugely helpful, and as we ramp up, again, we're still very young, and we're trying to solve that problem of closing the gap between people who make appointments and those who actually attend them. I think is it 35% actually attend their appointment?
35 to 40% actually attend.
And that's even with a virtual option, so we're trying to solve for that and find who are the people who are ready for that intervention. But for each person, that is someone who, if they're putting away money, that they're better prepared for a financial emergency and they're not living paycheck to
And I
paycheck.
think 70% of Americans are about $400 or $500 away from needing help, whether it's a credit card,
One medical
a
bill.
charity. So,
Or-
I mean, we're not just talking, I know we're talking about the most disparately impacted people, as we should always center in these discussions, but I think it's very easy for the others to tell themselves like, well, that's not me, but then all of a sudden it is, right?
Exactly.
Because I got injured on the job, or had a child that needed care and I had to quit my job. I did work in food security for a time, so I also think it would be good to reach out to the partner agencies, to the Food Bank of Eastern Oklahoma, and make sure they have your resource to pass through. I know a lot of times, 211 has kind of been the thing that gets pushed, but especially for the food programs that are based in our city, if they could just automatically say, because on intake, we usually ask a question like, what caused you to need to use our service today? Most of the time, it's like, I am on a very fixed income and the expenses have gone up. It's kind of a no-brainer. But to what we heard here today, if we could just strategically see where the resources are, what I have found is a lot of people might only need that one little warm handoff and then they're on their way. There's others, like seniors on fixed incomes, disabled folks, every day they are trying to figure out how to stretch the dollars that they are very fixed on as everything escalates, and we need to be mindful too. I heard Councilor Bellis talk about utility increases. I think it's easy for us to be like, it's only $5 a month, but it's compounding.
It is.
So we really need to be mindful, and do what we can do. But I do think that I feel better about this discussion we've had today, because I don't think we've really taken a deeper dive into FEC for a while. So I'm glad that we held space for this. And I'm taking notes of what we can do to help boost the signal to create more impact.
And then what I was gonna add is, we would love, I feel like I could speak on behalf of Social Response and Public Goodwill too, that we'd love to come to a town hall.
Yeah.
We're going to have one and share.
Yes.
We have done that at Councilor Vanessa Hall Harper, as well as Arjuna. We've had conversations about it too, so we'd love to
Right.
come and share with your constituents and have those conversations. And then just for knowledge sake, we do have co-locations at the Dream Center, South Tulsa Community House, the Parent Resource Center, which I mentioned, and at Women in Recovery, as well as
And the
municipal
and the court.
Yeah, so.
And you're headquartered in District 5, the heart of Tulsa.
Yes. So.
I guess we're the pocket of Tulsa, District 7.
Yeah.
The wallet of Tulsa.
I try not to say anything about District 4 because we have all the cool stuff, so I just
That's
leave
right.
it.
The playground of Tulsa.
Yeah. All right, well, thank you all so much, and thanks for
Thank
follow-up
you.
information and everyone's time. We really appreciate it.
Thank you.
Super illuminating.
It was so nice to meet you. Thank you.
Thank you.
We are are moving on to agenda item 4, sorry, I was about to skip right over Crystal still being here. Okay, Crystal Reyes, reappointment to the Tulsa City County Board of Health, term expires May 1st, 2031. You missed one of 17 meetings, devastating. You're probably in Council
And
District
other
4.
meetings at the
All
same
right.
time.
And why was that?
I was on a Zoom call and simultaneously like listening in.
Yeah, Deputy Mayor Reyes, tell us about your,
Your
experience
one
serving
absence.
on the Tulsa City County Health Department Board and, what you have, tell us more about just
thank
your
you.
continued service. I'm so glad that you are helping bridge municipal and city county health department
Oh,
governance, so that's good.
Well, thank you so much, counselors, and for those that were here to appoint me the first time. I remember just being so excited about that, and coming from New York City, working at the health department there, and being in health and human services for a long time. It was just like an honor to work, or to serve on the Board of Health. And it also is, I think, the first thing that happened, one of the first things that happened when I moved to Tulsa, so 6 years ago, I've been here 6 years now too, as a resident. The pandemic occurred during my tenure there, and so I was really grateful to be there to help support some of the outreach and to our immigrant communities and also our Spanish-speaking communities. And so we did some great work with the health department in collaboration with our Hispanic Affairs Commission and also BEST. And the health department has a bilingual communications officer as a result of those efforts. So I think it's really great to be able to bring the needs of the community that we see here at City Hall and the work that I was doing in resilience and equity, and now as deputy mayor, bring that to the health department and see what we could do to support the health department and also broader community health.
I'm just glad you have the time and energy to take this on.
To keep
You
doing.
seem ideally
Well,
suited to it.
No, I mean, I just think it's so important, bridging those different governmental layers as well as especially with the different ways that federal cuts are hitting healthcare right now, and just us as a whole city need to be hyper aware of that and how that affects access, so I'm glad you're they're
happy to
solving
serve.
all of that.
Yeah, happy to serve and support,
Great, thank you so much. All right, we'll be voting on this at a 5 o'clock meeting, we'll see what happens.
Okay.
Okay.
You will need to attend.
Yeah, you are if you did. Agenda item 5, thank you so much.
Thanks.
Ordinance amending the fiscal year 2024-2025 budget to make supplemental appropriations of $84,200 recognized from the revenue within the TMUA sewer operating fund, collection cost reimbursement. This sounds glamorous.
Very glamorous.
Yeah.
It's emergency sewer repairs always are. Jared Moore from Budget. This is, there was emergency repair work on a commercial establishment. They weren't meeting permitting regulations, so we had to select and do the work for them, and so this was just their reimbursement for that work. So we are reappropriating it into their emergency contract so that it will be available for future emergencies.
Great. Yeah, glad they paid up. All right, agenda item 6, is there
Gonna
any
get
questions?
fixed one way or
Yep,
another.
yep. Agenda item 6, ordinance amending the fiscal year 2024-2025 budget to transfer available appropriations of $1,473,000 between projects within the TMUA Sewer Capital Project Subfund, Upper Joe Creek, East Branch.
Yes, ma'am. This is essentially moving money between projects. At its base, it is simply a matter of timing. The projects we are reducing will be funded in revenue bonds at an upcoming time. The work will begin there, so this Upper Joe Creek can begin earlier, so we're putting the cash there so that it can proceed work right now.
Okay, makes sense. Any questions? All right, agenda item 7, let me decide if I'm reading all this. I'm going to. All right.
In your
Do I-
best auctioneer voice.
Yeah, ordinance amending the fiscal year 2024-2025 budget of the city of Tulsa, Oklahoma to transfer available appropriations of $8,856.78 between projects within the Oklahoma Water Resources Board, 2013A promissory note subfund, $54,444.86 between projects within the OWRB, 2013B promissory note subfund, $357,968.06 between projects within the OWRB 2014B promissory note subfund, $8,165.30 $0.03 between the projects within the OWRB 2009 Promissory Note Subfund, $102,803.11 between the projects within the OWRB 2014C Promissory Note Subfund, $415,852.99 between projects within the OWRB 2015A Promissory Note Subfund, $93,052.75 between the projects within the OWRB 2017A Promissory Note Subfund, $577,632.43 between projects within the OWRB 2018 Promissory Note Subfund. Okay, that was the whole thing.
That's stellar.
You are a superstar.
No kidding.
We'll get to hear Lakin.
There was just a lot of exact dollar amounts.
Counselor Lakin will get to do that on the 21st.
Well, I'll have to keep talking.
Yeah, let's see if you can do that more.
The 4th.
You did it better.
Alright, what are we doing?
So this was 8 OWRB revenue bond funds. We worked jointly with the OWRB to get approvals to move these monies, and essentially, Mr. Lichty could speak to it much more intelligently than I, but swept all projects that were finishing up, either completed, had sufficient funds to finish, et cetera, to roll those into an equivalent Joe LaFortune project in each one of them to continue working it.
So all those dollars are being consolidated to go towards the LaFortune project?
Yes, there'll be a LaFortune project in each one of those funds because that is the accounting structure we have, but that is what's happening.
Okay.
All the money's going to that one
And
project.
will these fund balances that are being moved over going to be fully utilized, or then potentially not?
Well, the intent and expectation now is to be fully utilized. Public Works and Water and Sewer always comes through annually and reviews the projects to see if, essentially this process that leads to this, are they gonna need more money, less money, et cetera. And so if additional funds from this will be left over, they will do a review and repurpose elsewhere.
Yeah, can you, yeah. You're like, they have inquisitive faces, I'll explain more, thank you so much.
Where are the dollars going is really what
So-
I'm asking.
So the project that we're moving into is an ongoing project. It's actually was funded half with OWRB funds, and we ended up having to fund it half with cash. I think it was Rev bond money, I can't remember, but it was cash. So all of these projects are finished up, so we are actually taking this OWRB funds and putting it into an ongoing project, so these OWRB funds will be used.
What's the total cost of the ongoing project, do you know?
The total cost of the Upper Joe Creek project was like $5.5 or $6 million, and we had already taken out a fund, an OWRB loan, and then the cost, of course, we had
Accelerated.
COVID
Yeah.
and the inflation just went crazy, and so, it ended up costing us more, so we ended up having to fund half of it with cash. And now we said, okay, we finished all these other OWRB projects, that money's just sitting there, let's take that money, put it into this ongoing OWRB project. Because if we have an OWRB project, it actually requires more paperwork, and so this actually allows us to put it all into one OWRB project that is ongoing, where we're already doing all the paperwork necessary,
And are we still carrying the loan?
yes.
Okay.
Yeah, that money will still be OWRB loan money, we are not wiping it out, it will still be.
Was there a discussion to use these fund balances to lower the debt, or no?
That,
Internally, Water and Sewer
yes, it was Eric Lee's decision and Team UA's
Recommendation
decision.
to put it in the
And-
project rather
yes.
than cure the debt?
That's
There is a
right.
price point where servicing the debt is cheaper than taking out a new OWR loan or just simply using those funds to complete projects that we already have on the books.
So it was determined it was more efficient to go into the project rather, okay.
I can imagine that being a timing
Sure.
thing with other,
Cost acceleration
yeah, with other
versus-
cost accelerations.
I just
I don't know.
wanna ask the question, cause I'm sure people will ask us.
Yes.
Okay.
Alright, anything else on this item? Thank you so much for the clarification. Alright, this one's kind of a sad one. Item 8, revocation / termination of the right-of-way occupancy permit between the City of Tulsa and Tulsa Bike Share Inc., issued for the use and occupancy of the city's right-of-way to allow for the care and utilization of public property in various locations for the installation, display, use, and maintenance of bikes, bike racks, and kiosks. This program launched the same day the scooters came out. So that's what happened. But yeah, so we have,
Market competition?
yeah, yeah, we have Paul Zachary here to tell us the sad tale.
Yes, Paul Zachary, Public Works. We did issue, and that's the thickness of the package, it shows all the sites that we did these items on. And Tulsa Bike Share, Inc. has ceased its operations. The city of Tulsa is gonna take the ownership of these bike racks. We've already had to take a couple out because they've been damaged, they were hit. But we're looking at putting the city of Tulsa logo and marking those, and we're working through that with traffic engineering right now. But, so we need to get them out of their responsibility, or whoever, to, or any successor that might be, it's gonna just move it all to the city of Tulsa. So we're gonna try to maintain bike racks, and we'll partner with people as we go along, but this is the first step to do that.
So just to be super clear to the public, the entity that required this no longer exists. We are not making them go away, they've already gone away.
Yeah.
So we're just doing the housekeeping that
Yes,
comes
ma'am.
along with that.
So that we can expend our money on these things, because these were all done not to cost the public anything, so.
Yeah.
And then we get the bike racks.
Yes, ma'am.
Do we get any bikes?
Right, they're already there and installed, so.
Yeah. Do we get bikes too, or no?
No, it's not the bikes, it is
Okay.
just
No, it's just checking.
private bikes can
Yeah.
go into these.
Yeah.
But should a future entrepreneur want to look at a model, then
We,
there's
we have all the
infrastructure.
pictures to show them.
There's-
There you
They
go.
There's a
literally-
pathway.
We'll
I
start
remember having
marketing.
this discussion, their launch weekend was the weekend Lime Scooters came
I
into
know,
town.
so what's very
Just terrible
interesting
timing.
though, in like New York City, the bike share thing is way more popular
Mm-hmm.
than the scooter thing, so maybe when we get like safety data,
There's
it'll
different,
drive
there's
decisions.
There's infrastructure needs. I know we've seen critiques over time of bike lanes and things like that, and part of it's because we do it patchwork in spots and there's not a whole
Correct.
network for people to access. Okay, any further inquiries about the demise of this bike share program? Okay. Sorry, I'm just actually Paul brought a funeral to the table.
There's
Okay.
an opportunity to fill the void.
Yeah, there is. Alright, item 9, license agreement between the city of Tulsa and Carol Jo Kalkman, revocable trust for property located at 3308 South Florence Avenue, Charlene, ESTB 69 edition for installation of a colored concrete driveway within the street right of way. This classically is in Council District 9.
So, this request for the license agreement was reviewed by City of Tulsa staff and representatives of the various authorities, boards and commissions and private entities, and we did not receive any objections. This is the standard that we get here, specialty concrete, things like that. If one of the right-of-way occupants needs to replace it, it's going back as plain concrete unless they work out a deal with the property owner to do that. But it's basically, it's the property owner's responsibility to put it back as in this improved condition. So it's just to minimize liability on the public for improvements in our right-of-way.
Do we know the color?
That's what I was gonna ask.
Is it garish? Because then we can say no. No, I'm kidding.
It looks like gravel right now, let's see, the pictures.
I assume.
Yeah,
Well, as long as
there's some
Councilor Busch
graphics
can
on
write
there,
on it.
but it's not the salted pitted one
Yeah,
that we talked
that's
about.
wonderful.
Yeah.
Okay, well, thank you so much. With that, item 10, we are adjourned.
All right.
Fun along the way. All right.